Good morning and welcome to Sapientia Xpress on Radio Sapientia 95.3 FM. I'm Geoman, and it seems I'll be here alone on Sapientia Xpress, but not to worry. Yesterday on Sapientia Xpress, we did inform you that yesterday, that is July 22nd, was World Brain Day. And we made a promise that today we are going to bring in a specialist to talk about that. Talk about the challenges, the different brain challenges Nigerians go through every day. We'll look at prevention. We'll look at those who are already down with these conditions, what can be done, and just all of the tips that we need, not only one to make us have awareness about different conditions, but also to help different people, different families who are going with this, cope with the problem. Today on Sapientia Xpress, I'm going to connect immediately to my guest, and we'll take the conversation up from there. Geoman on Sapientia Xpress this morning. Okay, once he picks, we'll begin this conversation right now. Okay. I hope he's there. I hope he's there. Okay, good morning, sir.
Hi, good morning, Jude.
Yes, good morning and welcome to Sapientia Xpress on Sapientia's channel.
Thank you very much.
Okay, I think I get your audio perfectly. My guest today on Sapientia Xpress is a public health policy and management specialist. He's the co-founder of Sub-Saharan Africa Brain Health Initiatives, a Global Atlantic Fellow for Equity in Brain Health. He's also a visiting research fellow at Trepel Lab, Trinity College Institute of Neurosciences, Dublin, Ireland. Good morning and welcome, Dr. Laz Ude Eze.
Thank you, Jude. Well done.
Yes,
morning,
I'm very sure when I was reeling out all of your qualifications, many people did not know you are one now.
All
right. Okay, for the sake of this program, I'm going to ask you these questions in English, but feel very free because of our audience to break it down in Igbo language, so a vast majority of our listeners can understand what we are saying. But also, here and there, you can drop one or two things in English for those who do not understand Igbo. I hope we got that very clear, sir.
Thank you.
Okay, so let's begin with this. Yesterday was World Brain Day, and the whole emphasis, the theme for 2026 is neurological care for everyone, everywhere. Is that okay? No, sorry, brain health access for all. I think I got that right. Right?
Yeah, access for all.
Okay, brain health access for all. It's all about ensuring that everyone, everywhere has this access. Now, let's begin, first of all, with you enlightening us on what brain health really means. What does it really mean, brain health?
Thank you very much, Jude. Brain health, let's begin from the definition of health, then we attach the brain to it. Health, by WHO definition, is a state of complete physical, psychological, and social well-being, and not just the absence of disease or infirmity. So physical, mental, or psychological, social well-being, and not just the absence of disease or infirmity. So when you now bring brain health, is now the state of functioning of the brain, across the cognitive, sensory, behavioral, and, motor domains, different aspects of the brain. So put it in simpler terms, a complete state of the anatomy, that's the physical state of the brain, and the functionality of the brain. You get, so, and the brain does, it coordinates everything that's happened in our body. The entire body organs, their job is the coordination center at the brain.
Yeah.
Whether the ones we do intentionally and the ones we don't even think about, like you are sleeping, your heart is beating, and you are breathing. You don't think about it.
Yeah.
Everything has a center in the brain. So the cognition, that's the ability to think or learn, think about things, how to solve problems, reasoning. That's the cognitive functions. You have the motor functions, like the movements of the body. You raise your leg, you think, oh, let me raise my leg. And there's a part of brain that will send signals through the spine, the spinal cord, through the nerves, and they will now pull the muscle for us to move. Sensory, touch. When you touch any part of the body, you feel that, oh, something has touched you.
Yeah.
It's also part of the brain that coordinates that. Emotions, behavior, mood, the capacity to interpret, interact with people, have those emotional feelings, not just the physical feeling, So these are different aspects of the brain. So in a situation to ensure that it's working optimally, that's brain health. And it begins from pregnancy up till when one gets old. So I try to break
when you say pregnancy, you mean when one is still in the womb, right?
Yes.
Okay. Now, the question I'm going to ask you is this. Let's break it down for our people and have some kind of ABCD to all of these things. ABCD, I mean, is, first of all, let's talk about when our brains and what makes our brains function optimally. So let's talk about those, whether lifestyle, whether diet, whatever it is, how to take proper care of the brain such that it takes care of us. Let's also talk about the downside, the upside first, the things that should be done, the things that makes it function optimally and all of that. And then we also talk about the downside. And downside, I mean here is what are those, maybe lifestyle, maybe diet, maybe environment, this and that, job, whatever it is that impacts negatively on our brain, such that everybody from my younger brother to my grandmother listening will properly understand and appreciate what to start doing more, and what to stop doing right now.
That's right. Like I mentioned, caring for the brain begins from the womb, because the brain, when the child is developing, is one of the organs that it also develops. And if it doesn't develop well at that stage, then there's an issue. When people take drugs anyhow when they are pregnant, they could have congenital malformation, which may even affect the brain. In fact, I've had either 2 or 3 babies that I've had delivered without brain and encephaly. Of course, it's not compatible with life. Nobody can come and be breathing without a brain. And some have hydrocephalus, the one that the head will be big because so there are some defects, congenital, that could happen. But even during childbirth, very important. And that's why we encourage people to deliver their children in hospitals and also with midwives, not just anybody who is wearing white or green or yellow and bearing titles, but trained people, because during childbirth, if there's a delayed, labor or obstructed labor, obstruction, Normally within 8 to 12 hours, a child should come out from the onset of labor. 12 hours for those who are having babies for the first time, but mostly those who have had babies before, their labor lasts mostly 8 hours. So from when they get into the active phase, it needs to happen is monitored every aspect. The heartbeat of the child, everything is being monitored by trained hands. But what we have is, some persons who are not trained, some people use prayers, to be doing monitoring. And the woman can be in labor for 24 hours. And when the child is being delayed in labor, every contraction, blocks blood flow in the baby. And when the blood flow is interrupted, I beg your pardon.
Yeah.
It reduces the oxygen that gets to the baby's brain. And when oxygen is reduced, certain kind of damage happens. So that's why when certain children are born, they don't cry.
Okay.
That's not crying immediately they come out. It's a sign that the brain is already in trouble. Due to prolonged labor that's shut down blood supply to the brain for some time. And some of them come out even with brain damage, and they will be acting in a certain way for the rest of their life. So I started from this phase to begin to say that things that happen around pregnancy and childbirth have implications on the brain. They say, oh, no, more for man at school. Some of them are based on things that happen around their birth. And having said that, when a child comes out, cries, everything is okay. Nutrition is very important. As the body is growing, the brain is also growing. Children often have short-term memories. That's why at the age of 5, they can't remember anything they did at the age of 3. Because the brain is growing, some of those stuff is going away until it reaches a level where, they can, long-term memory part begins to develop and stuff. But nutrition is very key. The quality of what they are taking. Breastfeeding is the most important food for a baby, both for the body and the brain. Exclusive breastfeeding for 6 months and, other kinds of foods can come later. So proper nutrition, balanced diet, proteins, very important, fats, minerals, everything. The baby needs that to grow. Then in adolescents, early studying, going to school early, beginning to learn things early, it also helps the brain in thinking. Because when you begin to put in information in the brain, that's also what is going to develop some neurons. When you now think, you can't think about what you don't know. So it's what you put in that affect the cognitive functions of the brain. So going to school, basic education, all those things, is putting in information in the brain. And based on what people know, that's what they will think, and that helps. And it's been shown, even for the case of dementia, which I'll talk a bit about it later, that those who have very good education and brain development, and education is not only classroom stuff, even if someone is learning a skill, and, being taught different things, just gets useful information to the brain. And learning languages too is also helpful because the language center in the brain, especially for children, can learn as many languages as they are exposed to. Being multilingual is even proven in some studies to be somehow protective against dementia. Then at adolescence, what do people consume? Living a decent life, not use and abuse of drugs and substances. It harms the brain because many of those substances, excessive use of alcohol, tobacco, all those stuff has some effects. It may not be immediate, but some of them. But that of drug abuse is immediate. It goes directly to the brain, and begins to disorganize some elements. Normal elements within the brain. Then for midlife, general lifestyle of physical activity, healthy diets, social interactions, also good for the brain. Diabetes is not good for the brain. Hypertension is not good for the brain. Obesity is not good for the brain. So in those situations, some of them you can't really stop it if it will come. 9 out of 10 cases of hypertension, the cause is not known. Diabetes as well, mostly if you have the risk factors, some of it is affected by lifestyle, especially type 2 diabetes, sometimes no matter the lifestyle, it may still come at some point, but if it comes, if you keep checking and you find out it's there, manage it properly, because if it's not properly managed, the brain may suffer, because both diabetes and hypertension has a way of compromising the small blood vessels, which are like pipes, watering the brain. Let's take the blood. The brain also has its own water that is called cerebrospinal fluid. But apart from that fluid that is exclusive to the brain and the spine, there is also the blood flow that carries nutrients, and the brain cannot do without blood flow. It can't do without oxygen. It can't do without glucose, And by glucose is the form that carbohydrates and the energy stuff we take is breaking down, So the brain needs that, but it doesn't need excess of it. So use of the brain, interacting with people, social interaction is also good for the brain. Avoiding air pollutions, because when the air is polluted, a lot of substances could be in the air, which some of them can be toxic, and you breathe it in, it gets diffused into the blood. And the heart is located close to the brain. The heart and the brain can't do without each other, So immediately it gets from the lungs, diffused to the heart, it pumps. First place it will get to the brain, even before it circulates elsewhere. So these are general stuff that helps, because we talk about brain health not entirely from disease perspective but how we optimize it. Is now when it's not fully optimized, that a number of things begin to set in. And a lot of them has to do with, what we consume and also the relationships we keep, because there is the physical component like the anatomy. There's also the other component that is like the mind, the abstract parts, emotions, moods, So those ones has a lot to do with how you feel, who you interact with, how they make you feel, and all those. Depression, is something that also comes from perhaps those interactions when people keep a lot to themselves and don't air it out and all those. And that's the mental health component. So people often ask, what's the difference between brain health and mental health? Mental health is actually a component of brain health. So, but we often talk about mental health. So it's of recent that the language of brain health is coming out strongly, because it's not just about the mental that has more to do with mood and behavior, but also about the anatomy of the brain, which later in age, for some people, the brain might shrink and have what we call neurodegenerative disorders like dementia, Alzheimer's disease, and all. So, and each of those are also a topic on their own. So, like yesterday, we launched the Understand Dementia campaign at the Sub-Saharan Africa Brain Health Initiative, because it's an aspect of brain health that doesn't get much attention, and a lot of people don't quite understand. They give people dealing with dementia all kinds of labels, Some they say they are witch, or they are mad, or they are, or it's just old age, or all kinds of things. So So access to all is the theme, and by all is all ages. And different things at different ages, and that's why we're having this conversation.
Okay, now let's narrow down a little on dementia and Alzheimer's, right? Let's narrow down on that. I don't know if the same conditions that give rise to these two is also tied to stroke. Does it?
Yeah, dementia. Let me start with explain what dementia is. Dementia is an umbrella term. It's not a disease. It's not a single disease, right?
All right.
It's a syndrome. So it's an umbrella term for a spectrum of signs and symptoms, that could happen if people have certain kind of brain health conditions. Yes, stroke can cause vascular dementia. When stroke happens, and stroke often occurs in a situation of uncontrolled or poorly managed hypertension, where the blood pressure is not well controlled, it gets out of hand. And it can also occur in diabetes, where that hypertension can happen on its own. Hypertension can also, or high blood pressure, can also be a complication of diabetes. So when the blood vessel in the brain is obstructed, so it's like a pipe. So if something blocks the pipe and water is not coming out, it's obstruction. But if the pressure is too high and part of the pipe bursts, and water flows from the side, or it cracked somehow, and water starts flowing from the side and not just the nozzle. So that's what happens in stroke. So where is obstruction is ischemic stroke. Where the thing bursts and is also flowing from the side is hemorrhagic stroke. And blood will get to the brain. So where it does happen, it also affect the brain tissue, cause some damages, which might, over time, because the first time you see in stroke is the paralysis, the motor functions of the body. The side that is affected, one side may just paralyze. The person will not be able to move the hand or the leg, and the face will deviate to one side. So, but beyond that physical part, over time it could also lead to dementia, vascular dementia, where it could affect memory, it could affect behaviors, and it could affect cognitive functions. So in dementia, these functions of the brain are often affected. Memory is often affected, so there will be memory loss. But let me also say that it's not every case of memory loss that is dementia. There's amnesia, and it's normal for anybody to forget something, whether you are old or you are young and stuff. You can keep your phone and not remember where you keep it. That's not dementia, So, but the memory part of the brain is not just the short-term memory. Remembering your friend. Oh, this one of my secondary school classmates. You've not seen the person for 20 years. You see the person and you could know the person. His memory is the brain that remembers. So, knowing that, I should, this is Thursday morning, is a work day, I should dress up and go to work and do this Sapientia Xpress, is memory. So in the case of dementia, these memories might be lost, that you wake up and you will not even remember that you are supposed to go to work. You will not remember you are supposed to take your bath. The brain will not remember. Not that you choose not to bath, but the brain will not prompt to, have you had your bath? Have you brushed your mouth? Are you not going to work? You see somebody, you can't even know the person. So some people will be asking their children, who are you? They've forgotten their names. They no longer have memory of them. So it's that kind of memory loss. There could be behavioral changes. There could be cognitive dysfunctions, loss of certain cognitive abilities, So when it happens to the extent that it affects the person's daily activities, that's what happens in dementia. It may happen one-off, in the brain, just as the hotness of the body, high body temperature. You can find it in malaria, you can find it in flu, you can find it in many other health conditions. Measles can start with fever, So the same way certain symptoms that you see in dementia, you may also see it in other brain health conditions or mental health conditions, But that of, before you say one has dementia, is not just behavioral diagnosis. They also do certain checks, do MRI of the brain, and see that, this part of the brain is not how it's supposed to be. The hippocampus, where the memory center and all those things are located, it's been affected. Or the Broca area, the Wernicke area that controls language, speech, all those things. There's something wrong there. They also do PET scan, that look at the functions of the brain. When the brain is working, the proteins are there, some abnormal proteins there. They could check the fluid that waters the brain, the CSF, cerebrospinal fluid, and see if there are some things there that are not supposed to be there. Substances that is not supposed to be there. Look at the blood, they do various stuff by experts, neurologists, geriatricians, radiologists. Spectrum of persons, are needed to make the diagnosis. So it's not when you see somebody that is, this one is forgetful, he has dementia, And people use the language to abuse people. You are demented, It's not the appropriate. You shouldn't shame people for a health condition.
Yes.
It's like using that one man has malaria to abuse the person, So we don't encourage using health condition to abuse, because those things breed stigma. And, so dementia is not a cause of, it's not a normal part of aging. That someone is old doesn't mean the person should lose their mind, So, but if it happens, it happens. And people need to understand it, provide support and care to persons involved. People always make fun of it until their loved one is involved.
That's true.
And that's something we need to stop. So we should all be concerned.
Now, I want you to do this in 3 minutes, and I want you to do this in Igbo. What I want you to do in Igbo is to imagine that you travel to the village and you are speaking to, your omona, and it's elderly people, and you want to give them certain quick tips because you're traveling, you're on your way to the airport and you don't have all the time, but you just want to give them some quick tips because you've noticed some lifestyle, some things they do without, I wouldn't want to use the word ignorance, but yes, but even though that's really what it is, we do certain things because we don't know, we think it's the best thing to do, but we are really harming our brain health. And you want to give them these tips because not only will it help them, but when they get back home, they can also pass this information to the younger ones. I want you to, in Igbo language, give us those quick tips we need to know, things to stop doing and things to start doing to ensure we have excellent brain health.
Okay, Uncle no kwasi.
Mba Central Igbo.
Onye ọbụla na-anụmakwu okwu kwasi. Okay. Ngemi na specific to dementia because brain health is too broad.
Okay, dementia.
Specific to dementia. Dementia bụ ya na-eme ọ na-emekarị ndị okenye, ọ na-emekarị ha affect. O nwere nke mere maybe agadi nwanyị agadi nwoke n'ime abalị maybe na ọ pụrụ ka onye ọma amị na ọ maazị ụzọ ebe ọnụ ya ọ banye ọnọ ndị ọzọ asị na ọ bịara ịta ha wich ihe a bụ ihe ziri ezi so ihe ọbụla a na-eri adịghị mma ka akwụsịnata iri ya ka onye ọbụla na-eri ihe dị mma na-eri mkpụrụ osisi hapụ ịṅụ oke mmanya hapụ ise igbo ma siga hapụ iri ihe ụfọdụ anaghị edozi ahụ edozi onye ọbụla na-eme njem ya na ndị agbata obi na-emezi mmekọ na-ebi ezigbo ndụ. Onye hụkwanụ nke adịghị mma, biko ka akpọrọ ndị ahụ jee ụlọọgwụ ka enyochaa ha, maọbụ nwata maọbụ okenye, ka anyị hapụ ị na-ezo ha ezo maka na si na ihe ha metere. Ọ dị ezigbo mkpa, especially ebe ọ dị n'ebe ndị nne na nna anyị, maka nke a na-akpọ dementia, ya na-emetụta ka ndị mmadụ si eme omume. Ọ na-emekarị ndị agadi, onwe ihe ha metere, ihe ha enweghị ike ime anything maka ya. So nke ọbụla agbanwejuru anya biko ka anyị jee ezigbo ụlọ ọgwụ, ọ bụkwa ndị a nọcha n'akụkụ ụzọ, nọcha na paakị na-ere ọgwụ, otu ọgwụ na-agwọ 50 things. So anyị jee ezigbo ụlọ ọgwụ ka enyocha mara ihe a ga-eme, maka na ahụike dị ezigbo mma, mana mgbochi ka mma karịa ọgwụgwọ.
Yes, thank you so much. Yeah, I see you in London speaking, trying to teach everybody Okposi. We'll have time to do all of that. All right. God bless you. Second half of the program, I'll get to engage with the audience and we'll talk about all of the things we learned from you and let's see how iron can sharpen iron. Thank you so much. I'll keep in touch.